All right, we've seen a lot of COVID headlines this week. Let's bring in Dr. David Winter to break it all down for us from Baylor Scott and White Health. Good to see you.
Good morning, Sonia. Good to see you.
All right, so let's start with the big news today. Pfizer's announcement this morning. What does this mean for businesses?
Well, the good news is Pfizer now is planning to be fully approved by the FDA. Now, they've been emergency approved, but that's not the same thing. This pandemic is an emergency, but after they get full approval, they can actually market and sell to companies, to businesses, to the public. They don't have to go through the government. So a big change there. Also, it shows that they've actually proven that they're very, very safe. Emergency authorization means they went through some fast processes, but now they've done the full spectrum of studies, and they are indeed safe, as we think the other vaccines also are, Sonia.
Yeah, and time really being on our side here as well. Those longer-term studies have been able to be, conducted and evaluated. Dr. Winter, I tweeted this earlier this week. The ACIP is meeting next Wednesday. Let's talk about who they are and what they have to discuss.
Yeah, that's the Advisory Committee for Immunization Practices. They advise the FDA. So they're going to meet next week and see if, in fact, they think that the Pfizer vaccine for children aged 12, 13, 14, and 15 is safe. We fully expect that they're going to make the decision that they are, but that has to go through that process. And if so, then it'll be open for younger children.
Yeah, and that move could be huge, Dr. Winter, right? Because we keep talking about this unicorn of herd immunity, and that includes the younger population, these kids. So how big of a deal do you think this would be? And I'm surprised with Kaylee Hartung's story from ABC News showing those figures as it relates to parents and their, potential hesitancy / confidence in getting their kids vaccinated. What are you hearing? And sort of tell me about this, this move vaccinating kids.
Yeah, I think it's important that we get this virus tamed in this country. We're doing very, very well. The last 3 weeks, we've seen a decrease in the coronavirus cases all around the country. But look overseas. Look over in the other countries. They're having major problems. India's in shambles right now. So is Brazil, Germany, Italy, France, all in lockdown or semi-lockdowns. So that virus is still out there. We haven't won the war. And it's going to come back around to us again if we don't get folks vaccinated. I look back to the measles vaccine. Measles was extinct in America in the year 2000. Then some women or some kids stopped getting the vaccines, and guess what? It's back. It's back with a vengeance. So we got to keep up on top of this. The more people that get vaccinated, the sooner we can actually turn down and get back to near normalcy. So I'm pushing the vaccine. I think it's very important that kids and everyone gets the vaccine, Sonia.
Okay, so I'm glad we're talking about vaccines now, because a lot of people say, okay, well, I have full protection. I'm double vaccinated. Now, what happens if I'm around unvaccinated people? Do I have protection? Can I take my mask off?
Well, the studies have clearly shown that if you've been fully vaccinated, you will not die of the disease. You will not get seriously ill. You won't have to go in the hospital. You might get a mild case, but even those are uncommon. So yes, you are protected. And the CDC has actually come out and said that if you've been fully vaccinated, when you're outdoors, you don't have to wear a mask unless you're in a very crowded place. But walking in the parks is fine. You can get out and exercise without a mask on. We're starting to open up a little bit with this. So it's going to make a big difference, I think, Sonia.
Dr. Winter, finally, you mentioned India and Brazil and some of these other countries in Western Europe. Let's talk quickly about variants. What do we know about them right now as it relates to these vaccines? How much protection do they offer?
Yeah, as long as the virus is multiplying in these countries, it has a chance then to mutate, to form variants. And those variants have the potential to be more contagious, to be more deadly, and less responsive to the vaccines. That hasn't happened yet. So for all the vaccines that are out there, they're working against the viruses, but we worry about that going forward. That's why we need to get a hold on this pandemic around the world. But so far, you can be reassured, if you've been vaccinated, you are protected.
All right, Dr. David Winter, thank you for putting that in context for us. Always appreciate you.